Hello, here's how I study DMPA in 4 minutes. DMPA injection is a contraceptive. It stands for depomedroxyprogesterone acetate. It is available under the National Family Planning Program with the name of Antara. Here we have a picture of Antara. The dose required is 150 milligram. It is given by intramuscular route. It is repeated every 3 months and there is a window period of 4 weeks. The mechanism of action is by anovulation. Let's look at some advantages. Reduced sickling. Therefore, it is important in patients of sickle cell anemia. Reduced frequency of seizures. Therefore, it is important in epileptic patients. And since this does not have estrogen as its component, there will be no side effects of estrogen. Then let's look at the disadvantages. There is delayed return of fertility. There is delayed return of fertility after we stop using this contraceptive. Okay. Second is that there is bleeding irregularities. And third is it decreases the bone mineral density. The most common side effect is bleeding irregularities. Let's look at some case scenarios. If a user of DMPA has to take another DMPA injection, she will come after 3 months because that is the duration of action. So the scheduled date will be after 3 months of previous usage. With this knowledge, let's see the first case. If she comes on the scheduled date, what will we do? We will give her the DMPA injection. But if she has to go somewhere, if she has to travel, can she come earlier? Yes, she can come as early as 2 weeks. And she can come as late as 4 weeks. Because 4 weeks is the window period, right? So if she comes 2 weeks earlier, or if she comes within the 4 weeks, we will give her the DMPA injection. Next, what if she comes after 4 weeks? Then what? Then we will have to rule out pregnancy. For that, we will do a UPT, urine pregnancy test. After that, we will give her the DMPA injection. And then we will also tell her to use a backup contraceptive for 7 days. So this is how we are going to counsel. In short, DMPA is a contraceptive with the dosage of 150 milligram. It is given intramuscularly. It is present with the name of Antara. Then there's a window period of 4 weeks. The duration is of 3 months. And then we can have 3 case scenarios. That's all. Then now you're ready for your viva.